This video is all about terminology, specifically terminology used in the small animal industry, but also I think a lot of this has to do more with the veterinary industry as well. So there's different components of medical terminology, and this you've probably learned in English, but the first part is the prefix. So this is the part of the word that it's at the very beginning of the word, and this can indicate a couple different things, but it can indicate a number, location, a time, status. So a or an means without or lack of. Our example here is anemia, which means without blood. Anti means against, or opposing. So antiseptic means against infection. Pre means before, so preoperative would mean before operating, or before an operation. Then there's a root word, and that root word is the part of the word that gives the fundamental meaning of the word. So cardi means heart. Cardiology would be the study of the heart. Gast or gastro means the stomach. So gastrostomy, would be the surgical opening of the stomach. Phleb or ven means vein. A phlebotomist is a person who obtains blood specifically from the veins, such as the jugular or the cephalic vein. Suffixes, this is the end part of the word, and this can indicate a procedure, a condition, a disease, a disorder. So the suffix algia means pain. So arthralgia or arthritis means painful joints. Centesis means a surgical puncture to remove fluid. A cystocentesis is removing fluid from the bladder specifically. Itis is inflammation. So bronchitis is inflammation of the bronchial tubes. And rhea means flow or discharge. This one's my personal favorite. Diarrhea is our example here, and this would be watery flow or discharge is what it actually means. There's also several different positional terms that we can use that describe different areas of the body. So ventral means the underside of the body, like the belly area. Cranial means towards the head. Anterior means the front of the body or towards the chest. And dorsal means the back or along their spine. Caudal means towards the tail. The dorsal or frontal plane. This is the plane that divides the body into the dorsal and ventral parts. Alright, so this is a plane that, if you can imagine this, it kind of bisects the animal's body through the chest so that it divides it into the back and the belly. So the back would be on top of the dorsal plane and the belly would be on the bottom of the dorsal plane. The transverse plane, this would be a horizontal or cross-sectional plane, and it is a plane that divides the body into the cranial and caudal parts. So instead of cutting through the animal horizontally, you're actually going to the cut itself would be vertical, but you would basically be bisecting the animal such that the head is on one side and the tail is on the other. All right, general terminology. Antisepsis, this is the process of applying some sort of preparation to the surface of a living tissue to prevent infection and inhibit any growth of microorganisms. A biopsy is a removal of a tissue sample for microscopic diagnosis and examination. And catheterization, this is the insertion of a sterile plastic tube into the urethra to remove urine, typically used in animals that are highly sedated. Contact transmission, this is actually a method of disease transmission that includes direct contact, so actually touching a sick animal to a sick animal. Indirect contact, which would be, so a person touches a sick animal, does not wash their hands, and then touches a healthy animal, that could actually transmit disease. Also droplet contact, that's best known as when we sneeze, droplets go out into the air and then can infect other people. It's the same thing with animals. Incubation is the period of time between the small animal contact with an infection and the appearance of disease symptoms. Depending on the disease and the animal, sometimes the incubation period is small, other times it's quite long. Infectious disease. So infectious diseases are those that are capable of being spread from one animal to another. Pocket pets are a term that we use to describe small pets that at one point were only thought of as laboratory animals, but now we keep them as pets as well. These would include gerbils, hamsters, guinea pigs, mice, and rats. Preventative healthcare programs. This is what you do when you take your dog to the vet every year, basically. This is a program that's designed by the veterinarian to help prevent diseases to your animal and any health problems. So this would include yearly vaccines for dogs, bi-yearly vaccines for horses or larger animals. Quarantine. So if we quarantine an animal, we are isolating that animal that is suspected to have been exposed to an infectious disease, or it could actually be infected, and we have to remove them from other animals so that other animals don't get infected. Spaying, this is the removal of female reproductive organs, specifically the ovaries. And zoonoses are diseases that can be transmitted from animals to humans. As always, please let me know if you have any questions. I hope this was super informative on any medical terminology that you did not already know.